welcome to the Physician Leaders Network webinar, Patient's Medical Home in Your Practice. This webinar will share a key message about the patient's medical home model, how it helps physicians and teams achieve their practice goals, and types of supports available to help practices with these changes. In this first segment, we will address the what and the why of the patient's medical home. My name is Mark Watt. I'm a senior consultant with the Alberta Medical Association. I have a long history in primary care with Primary Care Networks, as well as faculty with the Alberta AIM initiative prior to it being launched provincially. Also experience in healthcare systems, leading a hospital in British Columbia. And today I'm joined by Dr. Jordan Leroux. Jordan, can you introduce yourself?
Hi, I'm Jordan. I'm a physician out of Sylvan Lake, and our family physician out of Sylvan Lake. I have a couple other roles I'm involved with. The university in terms of teaching students and as well as residents. I'm a site director for the Red Deer Family Medicine program, and in this context, I'm also a little bit involved with the Primary Care Networks. I'm just coming out of a 4-year stint with the Wolf Creek PCN as the physician lead there, and I'm just transitioning into the Central Zone lead position for the next 3 to 6 years, I guess. So that's who I am, I guess, in a nutshell.
Well, thanks for your time today, Jordan. As people are getting themselves settled into this webinar, I just wanted to remind people that the Physician Leader Network is paving a path towards the integrated patient's medical home, and that this network has been designed by physicians, for physicians and family practice teams, PCN staff, and in our health profession partners. It is supported by the Alberta Medical Association, the Alberta Health Services, the Alberta College of Family Physicians, to provide free, easy access to essential tools and resources for physicians and their health teams to lead system transformation. As a reminder, we'll be presenting information that provides context and perhaps some key actions throughout the segment, and there is a summary handout available for download so you can share key points with colleagues and may serve as an outline for this session. So Dr. Leroux, can you tell me a little bit about the patient's medical home? Where has it come from, and why is this concept important to us now?
The patient medical home, certainly not a new concept. It's been evolving over the past number of years in Canada as well as abroad. I guess the best way to describe what a patient's medical home is, it's a place where patients feel most comfortable and, most at home to present and discuss their personal and their family health and medical concerns. It's a central hub for the timely provision and coordination for a comprehensive menu of health and medical services that patients will need. Basically, the home base for the continuous interaction between patients and their personal family physicians or their primary care providers. Now, this model of care has been endorsed nationally through the 2011 College of Family Physicians Vision paper, and provincially, this vision is supported through Primary Care Network Evolution or PCN Evolution. There's a large body of evidence that suggests that when primary care practices become more like patient medical homes, good things happen. Improvements are made in a variety of areas, and to list a few, the most important of which is patient outcomes or morbidity and mortality are all improved. Healthcare utilization is improved. Preventative care, there's an increased uptake there. The quality of care that is given improves. The timely access to care improves. Patient and provider satisfaction improves, and in terms of the bottom line of costs, the overall costs of care are also reduced. Now, I think the patient medical home model is very timely in that we're entering a new reality of increasingly complex patients with multiple comorbidities and an increasingly taxed system. I don't think I have to convince anybody of that. I think we all see it in all the corners of our worlds. The patient's medical home will be critical to providing a foundation in evolving our system to meet this new reality. While there is no perfect system out there, we do know that what leading systems have in common with each other is a robust primary care foundation where the patient's medical home exists in one format or another.
So thinking about this as from an international perspective, I know that the patient's medical home model, how we reference it here in Canada, elsewhere, it may be cited in such things as the patient-centered medical home. So clearly, patient-centeredness is a strong component of this model. Can you share some insight on what are some of the other components of this model?
For sure. It absolutely starts with the patient at the center, but it also has a number of other pillars and aspects to it. And we'll go through those point by point. On top of that, in addition to the patient at the center, we start off with the personal family physician for every patient, who will be the most responsible provider for his or her medical care. In addition to that, we move on towards team-based care. We move on to timely access to appointments within the practice, as well as coordination to services outside by referral. Comprehensive care of family practice services that meets the population and public health needs. Perhaps even most importantly, continuity of care. But continuity as a greater concept has three aspects to it. So we have continuity of care, continuity of relationships, and continuity of information, all for the patient's needs. Supporting this would be electronic medical records and electronic health information. Education and training, commitment to continued learning for those inside the medical home, as well as passing knowledge on to our future generations, like students, residents, and other healthcare professionals that are training in this context. Evaluation is critical. Committed to continuous quality improvement through measurement and evaluation. Basically, it's like being on an escalator. Unless you're actively trying to move up, you will slowly regress. And then finally here, system supports for the patient's medical homes. Internally for your own clinic processes and practices, as well as externally, such as government, PCNs, programs like AHS and AMA, etc., etc.
Wow, Jordan, it sounds like that's a lot of change for primary care practices.
You're right, Mark. It is a lot of change, but it is important to note that these changes are being supported at all levels. The patient's medical home model is the unified position of the elected leadership in Alberta. Primary Care Alliance, Section of General Practice, Section of Rural Medicine, PCNs, AMA, ACFP. I don't know if there's any other shorthand we can use. Academia as well. Also, we're not trying to make all of these changes at once. We're not trying to boil the ocean. We're advocating that you start with improvements in one area, then you move on to another area. You have to do this bite-sized.
Okay, so this sounds definitely like it's doable and very aspirational, but let me see if I can understand, some of the types of changes, how it might actually play out in real practice. So perhaps in a traditional model of care, and not that there's anything wrong with this model, but as an example, if Dave has an urgent issue and his regular family doctor can't see him for 8 days, so he decides that he would go to a walk-in clinic. There he's seen by a doctor that he doesn't know, doesn't have a relationship with, so provides his full history and the current symptoms that he's experiencing. He's examined by the physician and provided a lab requisition and instructed to follow up with his regular family doctor as able. So Dave now ends up waiting for his appointment for several days, in which time he's now beginning to worry about what have the test results uncovered. And when he arrives at his family physician office, the physician again explores the current systems to understand the recent history, as well as what occurred in the walk-in clinic. The physician tracks down his lab results from Netcare, reviews them, examines Dave, and provides a diagnosis for his concern. She also refers him to a specialist and is able to answer any of his immediate pressing questions. So as part of his ongoing care, Dave's doctor monitors his condition and prescribes medications as needed, and continues to help Dave and his family learn about the appropriate self-management aspects. Now, if we were thinking about the changes that you've described earlier in a patient's medical home model, Dave's care might look a little bit different. Dave calls his patient's medical home and he gets an appointment on the same day. His physician examines him, provides him with a lab requisition. The care team also notices at this that he needs a prescription renewal and offers him some preventative screening that he's due for. After his blood test, Dave goes on to the EMR patient care portal, where he books his follow-up appointment with his physician, and he also selects an option to be reminded with a text to his cell phone. Dave is a little bit worried about his results, and so he calls the patient care line, where he's reassured by one of the team members attached to Dave. On the day of his follow-up appointment, Dave's doctor provides him with a diagnosis and continues to refer him on to an appropriate specialist and answers any of his immediate questions. Ongoing, Dave is monitored by his physician and receives appropriate prescriptions, and his family are kept up to date on his condition. Dave also sees the care team who help him manage with different self-management strategies, and he attends group medical visits where he receives support from others with his condition and learns from them as well as from the care team. In this model, Dave and his family are very involved in the treatment and management of his care. So the physician in these examples have done the exact same things. However, we're talking about some extra value provided to Dave by reorganizing the care in a new way. Would that explain some of the changes that we're talking about?
Why, Mark, I think it would. That was a great example off the top of your head. All right, Mark, the Physician Leaders Network is engaging physicians at all levels to share key messages about the patient's medical home model. Now, how is the AMA preparing and aligning supports for physicians and teams?
That's a great question, Jordan. The AMA has conducted a literature review about systems who have been implementing the patient's medical home model. And we've adapted from a particular initiative called the Safety Net Medical Home Initiative. In this initiative, practice teams who had been successful in becoming more patient medical home-like were asked about what did they do and what order did they do them. And by harvesting the knowledge from these people who've been successful, they were able to create a model or a roadmap that helps organize and sequence a series of implementation steps. And we will cover some of these steps and the supports for teams in our next segment.
So you're saying basically we paved a path for others.
There is a path, and it's something that we can easily communicate and share with others.
Excellent.
This brings us to a close for the first segment of the Patient's Medical Home in Your Practice. The Physician Leaders Network is brought to you in partnership by the Alberta Medical Association, Alberta Health Services, and the Alberta College of Family Physicians. We hope you join us for segment 2.
Bye for now.